We're live.
Hello, and welcome to our Facebook Live series, Ask the Vision Loss Experts, Coping with COVID-19. My name is Dr. Tricia Grant, and I'm the Senior Director of Low Vision Research at the Chicago Lighthouse.
And I'm Dr. Brian Walensky. I'm a low vision optometrist in New York City, and I work with OrCam Technologies. Our intent for this series is to discuss topics, engage people, and share information as pertains to vision loss during this time of social isolation and the COVID-19 pandemic. And in these episodes, we want to bring guests and topics that concern the community during this time.
And we welcome everyone to join, whether you or a loved one are visually impaired or blind, or you just want to learn more about the experiences of people who have vision loss, especially during this time of social distancing.
So thank you to everyone who's been joining us each week. We really thank you. If you know someone, though, that can benefit from our discussions, or you want somebody to join in, or someone you think that will like this episode with us, take a moment to hit the share button on this post. And we also wanted to bring up today a question of the day. So what we wanted to ask is, whenever we get back to what the new normal is, what is one thing of the past that we're willing to let go of?
So please be sure to answer that question, put it in the comments below, and we're going to read the answers later. So today, as you noticed, we have a very special guest joining us from her home, Dr. Kelly Scherer, and she's the Director of Clinical Services and a full-time optometrist at the Chicago Lighthouse. And she provides both vision rehabilitative care as well as primary care optometric examinations. And before we get started talking to Dr. Scherer, I just want to tell you a bit about her. She graduated from the New England College of Optometry in Boston, Massachusetts, where she focused on ocular disease and low vision care. Following graduation, Dr. Scherer completed a residency at the Boston Veterans Affairs Medical Center in low vision, traumatic brain injury, and primary care optometry. During her time in Boston, Dr. Scherer volunteered with Massachusetts Association for the Blind and Visually Impaired and provided eye care in the rural villages of Belize, Central America, which is so great. And she did this through the Fellowship of Christian Optometrists. So thank you so much for joining us, Dr. Scherer. That's quite an impressive resume.
Thank you for having me.
We're really happy to have you here to talk to today.
Yeah, it's great. Welcome. Thanks for coming here today. And it's great to have another colleague here, as well as another alumni of New England College of Optometry.
Thanks.
Let's start. I really wanted to start out with a question for you, really just for everyone out there in our audience. What is low vision? And can you tell us a little bit about how you provide care for low vision patients? And also just, is low vision for someone who's visually impaired, or do you see blind patients as well?
Sure. So low vision is really describing anybody who has a permanent vision loss from any type of disease. So that can be a huge variety of conditions and any variety of vision loss. So some people have some mild vision loss to complete blindness. In low vision care, we service all these patients, from patients who have mild vision loss to patients who have no vision whatsoever. And the type of exam we do is more of a functional exam. So it's pretty different from a regular eye exam. What we do is discuss with people what kind of problems they're having because of their vision loss, and provide solutions and adaptive equipment and tools to help them do things a little bit easier.
Thank you for explaining that. I know a lot of people are very curious when you say the word low vision, what exactly that means. Mm-hmm. So since the pandemic started, healthcare professionals have been utilizing innovative methods for providing virtual care to their patients. And a couple of weeks ago, we talked to Dr. Smith, and he talked to us about the virtual teletherapy that he's providing. Have you been able to implement telehealth into your practice? And if so, how are you doing that?
Yes, so I've been seeing patients via telehealth since the end of March. So luckily we were able to get things going pretty quickly. Nice. It has been a transition for everybody in healthcare, figuring out how to service our patients. But we've been in touch and trying to keep the door open as much as we can in terms of servicing our patients from home.
Nice.
So, but we hear about telehealth and, virtual services. Some people may think it has to be like high tech, or you need some high tech stuff in order to have that virtual visit. So, patients get nervous about that. So do they have to have extensive tech skills to schedule, a virtual visit with you or even anybody?
No, so telehealth actually is very easy. It really just describes talking to your provider, not in the clinic face to face. And so that can be as simple as talking to your doctor over the phone. I've had some telephone conversations that are considered telehealth with my patients, or doing something like what we're doing today, like a video conference.
That's great. So can you walk us through a visit? So a patient wants to see you. How would they schedule this? And then what happens during the appointment?
Yeah, so patients schedule a telehealth visit just like they schedule a regular visit. All they have to do is call our clinic, and our staff are going to help them decide what type of visit is the easiest for them. So just a phone call or a video conference. And then I will reach out to the patient at the time of their visit, just like a regular visit. And just like a regular visit, we talk about what they're having problems with and how we can help them out. And it's really just a goal-focused exam like low vision normally is.
Yeah, exactly. No, definitely goal focused, figuring out what the needs are of the patient and meeting that. And also for follow-up is definitely important. So I just want to welcome everybody again. If anybody just joined us, I'm Dr. Brian Walensky. This is Dr. Tricia Grant from the Chicago Lighthouse. I work with OrCam and a low vision optometrist in New York City. And we're talking with Dr. Kelly Scherer from the Lighthouse, who's a low vision doctor. So thank you again for joining us today.
Thank you. And we want to remind everyone to answer our question today. And as a reminder, it is, what is one new normal of the present that you like and you want to stay? And Dr. Scherer, do you have something that you've been doing now that you weren't doing in the past and you hope that it can stick around in the future?
Yeah, one thing I think I've loved about this time is everyone's focus on mental health care and their openness with managing their personal mental health and really taking time to care for yourself.
Yeah.
It's been a good opportunity to do that, especially in a time of extra stress for some people.
Yes, that's a great one.
No, I definitely agree with that. We're seeing more awareness. We're definitely seeing, even on television, we're seeing more commercials about people taking care of their mental health. And as we spoke with Dr. Smith, it's definitely very important. And yeah, hopefully that does stay, that becomes a mainstay. I just wanted to mention, we heard from someone about what they like about this new normal or something that they want to stay. And it's Julie Hall, who says, what I hope continues is hand washing by everyone. It's gross to see someone go into the restroom and walk out without washing their hands. And I think we can all agree with that. Definitely.
Yes.
And I do know some other optometrists who are going back to practice now in some different cities and states. And actually, they're making patients, as soon as they come in, wash their hands upon entering. So I think just more people are going to be more conscious of washing hands. And hopefully that does, yes, Julie, continue. And I definitely agree with you on that. I have another question for you, Dr. Scherer. So obviously, telehealth visits is very convenient for the patient. Maybe a little bit out of the comfort zone for us as doctors and other physicians who are out there doing these telehealth exams, because you're not in contact with the person. It's something totally different that we're getting used to. But as we're getting used to it, what are maybe some of the positives that you think that are coming out of it?
Yeah, so one of the biggest things that I've been really excited with telehealth is just improving access to care. A lot of the low vision community just has a multitude of barriers to accessing care because of mobility, or because they're not able to travel independently, or because they're relying on somebody else to give them a ride. And so we run into that all the time in the clinic, and to be able to offer similar care to what we can offer in the clinic virtually now, we can really reach patients from a further distance, or even patients that are in the same city as us, but just it's such a barrier for them to come into the clinic. So I think that's one of the biggest advantages of us setting up telehealth going forward. And the other thing I've noticed is right now I'm seeing patients in their home basically. And that's really ideal for low vision care. What we're trying to gather in this short visit that we have with our low vision patients is what's your day-to-day like? What are your struggles? What's your setup like? And I can get so much more information when they're walking me around their house saying, here's my work from home setup, but this isn't working. Here's the kitchen, I can't see well enough to get this done in here. And so that has been really great from a functional evaluation standpoint to be able to really see what people are working with right now.
Yeah, I think that's so great. I always, often when doing research, I am wishing that we can go into the patient's home a lot of the times, and it's not possible with what we were doing in the past, but it definitely seems like that's something that is coming to the future in current, which is great. So in your virtual care practice, are you able to, are you only seeing your established patients, so people that you may have seen already and who you have an established relationship with, and their current vision status, or can you accept new patients? And then also, in addition to that, does insurance cover these types of visits in the home?
So right now, actually, we're able to service anybody. We are seeing new and established patients. So anybody interested in low vision services who feels it's appropriate for them are welcome to contact us. And Medicare and most private insurers are covering these services, and our staff are available to help people, figure out what's covered.
Great.
Yeah, that's a good point. We brought that up in the past, that people should just also call their insurance companies, whether they're coming in for a not coming in, staying home for a low vision visit, or they're, doing a medical visit. They should check with their insurances to make sure that there's coverage. Right now, I do know that a lot of insurance companies are covering, but you just want to make certain, because there might be co-pays also, and you don't want to get a bill later that you're totally surprised about. So comprehensive low vision rehabilitation also includes other services, Dr. Scherer. So not just low vision exam, but that's the entry point. There's OT and psychology, like Dr. Smith does. So while are these able to be addressed also? Are you recommending, I guess, still all those visits through a low vision exam?
Yes. So with Lighthouse, we have occupational therapy and psychology in addition to low vision optometry. And all three of those services are operational right now via telehealth. We really focused on getting those up and running because of the model we have worked on for our clinic. We really see that low vision rehab is the most effective with all these services in place. And so once I see a patient, I help them to get set up with other services that they might need.
Great.
Yeah, that is great. So how does an individual recognize that it's time to see a low vision care provider? Is it something that their primary eye care provider is going to let them know? Do they need to know this information for themselves and kind of advocate for it? How do they find a Chicago Lighthouse, even if they're not in Chicago? How do they know that this type of care is available?
That's a good question. So a really good place to start is with your eye doctor. Most eye doctors are providing referrals to low vision care. And if they don't bring it up, it's a great time to bring it up. They might be familiar with somebody, but they might not mention it to you. It's important for the patient to recognize when they're having difficulty. Sometimes you might be having difficulty even though the vision's not what your doctor might consider severe enough to go to low vision, or vice versa. And so it's important for the individual to voice when they're having trouble. And that's a really good time to come to low vision and see what we can help with.
Right.
Exactly. I know that even in the American Academy of Ophthalmology and Optometry, the American Optometric Association, recommend that as soon as there is a diagnosis of something and there's even a mild drop in vision, that someone should see a low vision optometrist or a low vision specialist right away, as soon as possible, just because it helps set that up if anything gets worse, or that way it's not such a struggle later on. It's actually going to be an easier transition, and to find those solutions and find somebody's needs right away, sooner than later.
Yeah,
so definitely.
Yeah, I see patients who come earlier in their condition fare better in their rehab because they just know what's available. So when something changes, they know where to go and they know what's out there for them.
Great.
Do you foresee, telehealth as being here to stay? I mean, I actually hope so. Beyond this, pandemic, I think it's great.
I hope so too. Yes. I think it'll integrate really well with clinical care. I think as as we get back to regular clinic reopenings, telehealth will still serve a purpose in staying in touch with our patients, reaching patients that maybe are far, unable to travel. So I think it'll definitely serve a purpose, and I think it'll enhance care across all aspects of healthcare for sure.
Great. Well, thank you so much, Dr. Scherer, for being here and answering these questions for us. I think they're really important to our audience, and also for us to continue to have these conversations about how things are changing and how we're going to continue to be able to see our patients in the future. So thank you again for coming on today.
And thank you so much. And I look forward to maybe some more conversations about what work you're doing, and keep us updated.
Yes.
Thank you.
All right. Thank you, Dr. Scherer.
Thank you. So we will, if someone is interested in seeing Dr. Scherer's or low vision virtual services, we are going to post the link in the website where you can access and make an appointment, or even ask some more questions. So I'm going to ask the Chicago Lighthouse to please comment below and provide the link to our Ask the Experts not Facebook page, but our link that is on the Chicago Lighthouse website. And as a reminder, that is where you can watch previous episodes, and when we mention resources, you can go in there and look for some of those resources. So for this week, we will, in addition to adding this episode, we will also add a link to Dr. Scherer.
Yeah. So, Dr. Brandt, I wanted to ask you, what's something that you wouldn't mind getting rid of in the new normal?
I think, there's a couple of things. I definitely, when it comes to the sanitizing everything, I really like that places and public spaces are taking more time and really taking the sanitizing the areas more seriously. Going to the grocery store and people are wiping off the carts, and I really like that. And I really want that to continue because, beyond COVID, there are so many other flu season. I wonder if all of these measures can help, reduce the impact of flu each year. So I hope that stays. And I also like the fact that I am staying put a little bit more and not running around so much. So that, I was always on the go in the past, and I've been able to notice how important it is to settle into your home, and you could be so productive and do things that are really beneficial, more beneficial than, running around and doing different activities. So I think I'm going to spend a lot more time at home moving forward.
That's great.
So that was a great conversation we had with Dr. Scherer, and you also provide the same type of low vision services. And one thing that came to mind with the virtual services is, when you go into an exam room, typically there's an eye chart and you're able to measure visual acuity using the chart at different distances depending on what the vision level is. How do you think that is something that could be done? Because I imagine it's a very important part of care, is knowing vision status and visual acuity. So how could that be done? Do you have any idea or thoughts about how that could be done out of the home?
So in one way, there are ways that are being done, but I want to mention specifically in a low vision assessment. In low vision, really, it's about meeting someone's goals and meeting someone's needs. So really, visual acuity or reading someone's number, whether they're 2100 or 2200 or 2050, it's not about the number. It's about what somebody is able to accomplish and do. So with a low vision assessment, I mean, I could just say, grab the newspaper, grab something else. What is it that you want to do, depending on your vision? Or what piece of technology are you using? Are you using an assistive technology? And let's see, on an online assessment, how are you using it, and how can we help improve that skill? So really, it's not about the eye chart, which is good, but there are at times when we want to know what the vision is. One is because if someone's recognized as being what's called legally blind, which is 2200 or worse in the better seeing eye, or 20 degrees of vision or less, we want to know what is the vision. So there are ways where we can basically download an eye chart or share an eye chart virtually, sort of online, where it could be sized to a specific place. It's just the person has to be a certain distance away from their computer in order to tell. Yeah. So there are ways that it's being done, calibrated through computer eye charts. I mean, in my exam room, of course, I have an eye chart on the wall. But we not only have that eye chart on the wall that people are used to, we also have charts that are handheld that we hold, eye charts where I can get as close to you as 1 foot away and as far away as 10 feet. So it's really about spacing, it's about calibrating charts. But again, specifically in a low vision assessment, it's really, one, how are you using your technology, and what are your needs? So it's not really just about a number. It's about helping an individual.
Okay,
I did want to get to some, I wanted to get to some people's because I'm getting in more. We have actually Lena helping us. Sorry, guys, that's sending us all of your feedback for us. So thank you very much. I have Lisa Manabat says, I've started cooking a little bit more out of necessity and hope some of that continues. I guess, definitely. Cooking more, a lot of people are doing that. I think that's great to do. It better than like what I used to do is just constantly order in or eat fast food all the time, just because New York City. And like how you mentioned, Dr. Grant, is slowing down a little bit, being home, taking that time to cook a meal. So yeah, that is something that's going to be our new normal.
Yes, I agree. And I see she also said, Lisa said that she's been utilizing knife skills and that she learned from a CVRT I'm not familiar with. I would imagine that's someone who's very skilled in working with knives. So that's pretty cool. Dale Hall says, I am saving a ton of money by staying home. We cook more, workout as a family in the home, and we are on our cell phones less and spend a lot more quality time with each other. That's so nice. And he says he hopes that these new normals are there to stay. Yeah, I think that's wonderful. Families that are really connecting right now, that's definitely something you want to continue doing.
No, definitely. And I just want to comment on one question I see, and this is really important. Charlene Yules asks, and I think it's in regards, Charlene, to low vision assessments and doing this telehealth kind of things. You know, what if you were totally blind, no light perception? So for low vision, we do see blind and visually impaired patients, and I hope we expressed that before, or I hope Dr. Scherer did. I know I asked that initially because I see both. And the reason is because I do want to go over a history with someone who's blind. I want to know what assistive technology they're using. Maybe there's some other tools or something out there that I've heard of that they haven't that we can recommend. And also to go over sort of just everything that they're doing. Is there other skills that we need to go over? So I feel like I become more, even though, yes, low vision, we look at different tools, how to use what vision you have left, but also we recommend assistive technology. So I feel like I become like an advocate. I might recommend maybe you need more orientation and mobility skills. Maybe I'm going to recommend the psychologist or an OT or a home visit. And that's great too. Now we're doing the telehealth, which we just brought up, is that home assessment. So now we can see what's going on in somebody's home in their own environment rather than in a clinical environment in an exam room with bright lights and everything that we need there, where a home might not be like that. So definitely, we see patients both of visual impairment, whether it's mild, moderate, or severe or legally blind, to no light perception. So thank you for asking that, and I wanted to make sure that we got to that issue.
Yeah, and I just want to clarify that Lisa, the CVRT is Certified Vision Rehab Therapist. So that is, thank you for clarifying. So that's great. I wonder if they were able to teach that virtually as well. So again, lots of rehab happening in the home and virtually, which is really fantastic. So that concludes our session for today.
Well, before we go, I do want to just get to, and we'll come back to this, John. John Smith says he has a question about the progress on the treatment of X-linked retinitis pigmentosa. I heard Chicago Lighthouse is working on it. Sorry to surprise you with that one, Dr. Grant, but do you know what's being done at Chicago Lighthouse with retinitis pigmentosa and treatments? I mean, I actually would like to get more involved in that in the next episode, probably, John. I think it's a great topic with gene therapy and all the stuff that's going on, stem cell research. But what is anything specific that you're aware of? I mean, we'll come back to it.
Yeah, we will come back to it. And absolutely, we do have a Pangera Center at the Chicago Lighthouse who is working on this type of work. And I think it would be a great idea if we had an individual from one of the doctors join us on the show. If that's interest to people, again, we're asking everyone to send in the things that you're interested in hearing about, and we can pull in the experts to answer these questions. So we will get back to them.
I know a lot of my patients always ask about what treatments are on the horizon, and there are a lot of companies now doing, like I said, stem cell research and gene therapy research into these things. I know I work with a group of choroideremia where they're doing a lot of research as well, not just with RP, because a lot of people who have choroideremia get mistaken as having RP. So we can, let's bring, I would like to bring that up. Thank you, John, for bringing that up.
Yes, thank you.
So I think that's what we had today, right?
Yes, that is what we had today. So thank you everyone for, again, tuning in, sending in your questions. And we will be back next week. We have a guest next week. We will be honoring Memorial Day. So that's coming up. So we are going to talk a little bit about the Veterans Affairs and some of the services, and hope to have a veteran come on and talk to us about what his experience has been during this time. So thanks again. Tune in next week, and we will post the link if you're interested in scheduling an appointment with Dr. Scherer.
And thank you everybody for joining each week. Thank you for your questions. Thank you for bringing up such great topics. And everyone, please stay well, stay safe, and remember always wash your hands and don't touch your face. Thank you. Take care.